This question states that a patient is prescribed a medication with a high potential for abuse and no accepted medical use within the United States. Under which schedule of controlled substances would this medication fall? So let's take a look at this term over here, controlled substances. So the controlled substances follow a scheduling system, schedule. And you might notice that in your choices over here, because every choice is schedule and then has a number. So the scheduling system follows the Roman numeral system. So it follows 1, 2, 3, 4, and 5. And as you move down the ranking system, the general idea is that you are moving from a higher level of abuse risk, high abuse risk, all the way down to a low abuse risk. So there still is some level of risk for drug abuse, but it's not as higher on the scheduling list. Also, something to consider when you're looking at the scheduling system is that 2 through 5 have medical uses. Medical use, meaning that it's accepted within the United States that any drug within categories 2 through 5 has a legitimate medical purpose that it is prescribed for. However, in Schedule 1, there is no accepted medical use. So when we look at the choices based on this information that we see within our scheduling system, we could see that there's only one choice that has no accepted medical use. And this is important because in the question, they're stating there's no accepted medical use. So we're thinking maybe we should go with Schedule 1 as our choice because it has no accepted medical use, no accepted medical use in Schedule 1. Also in the question, it's stating that there is a high potential for abuse, and Schedule 1 also has the highest potential for abuse, as we can see based on this chart. So given all of that, we are going to go with option A, Schedule 1, because we could see that it has no accepted medical use and a high potential for abuse. Looking at the other choices, Schedule 2, Schedule 3, and Schedule 4, we could see that they are all within the category of having acceptable medical use, and they're less likely to be abused in comparison to Schedule 1.